Medication works because it takes care of symptoms, but unfortunately, you don't know what's going on. So after 2 years of practice, I decided that I can't be a doctor like this. So my good friend said, why don't you start your own kind of practice, and give people time to educate them. At that time in the 70s, we didn't have integrative medicine. The closest thing that we had was called holistic medicine. However, holistic medicine, of course, was a good approach because you take into consideration a person's mind, body, and spirit. You treat the whole person rather than symptoms and just a condition. So, as you know, the integrative medicine actually the term became popular in the 80s. From holistic medicine, and then you've heard of the term alternative medicine, right? There have been many kinds of alternative medicine, and then it came to be complementary medicine. And then finally in the 80s, the term integrative medicine became very popular. So what integrative medicine is, combining the best from the East and what is in the so-called conventional medicine. So in integrative medicine, you have using acupuncture. Nutrition, of course, is a very important part of integrative medicine. Okay? You also use, of course, stress management. We'll talk more about stress, because I think all of us know that stress is a killer. Okay? In fact, they have found that so many kinds of cancer will start after a person goes through a big stress situation. And that's because, your immune system gets imbalanced. Okay, but we'll talk a little bit more about that. You've heard the term that Ginny Peters talks about functional medicine. That's also a term that's used quite a bit, because functional medicine means that you're getting to the proper function of your body. Okay, a lot of it has to do with digestion, the foods that you're eating. And the other term that you hear a lot nowadays is inflammation. In fact, all disease processes start with inflammation. Okay? When there's inflammation, your body can't heal itself, and then your immune system goes down. Okay? Now, many of you have heard of the term yin and yang, right? In Chinese medicine, they've talked about that for thousands of years. Now, what does yin and yang mean? Can some of you know? Somebody said balance. Yes, very good. Exactly, the balance. Too much of one is going to offset the balance of the other, so that's not necessarily good. You want to be balanced, okay? And that's how traditional Chinese medicine approach a medical condition, is to get the person into balance. Actually, in Western medicine now, we understand what that means. We have the autonomic nervous system. You might have heard of that term. You've got the sympathetic, the fight or flight reaction, okay? And then you've got the parasympathetic. The parasympathetic is when you restore your body function. So again, we talk about the balance, the autonomic nervous system. Okay. Nowadays, we can actually measure a person's autonomic nervous system balance. They are what we call instrument that you can measure what we call heart rate variability. And cardiologists have actually known about this for many, many years, but they don't apply that, unfortunately, in the practice. Heart rate variability shows when your heart, you've got your heart rate, right? What we call the regular beat of your heart rate. But in between the heart rate, there's a lot of things going on. So you can actually measure what the heart rate variability is like. A person that has very good heart rate variability means a very good fluctuation. And kids have very good heart rate variability. And that's why kids generally stay very healthy and well. But as people grow older, the heart rate variability decreases. If you look at the measurement, it's almost like a flat line. There's not a lot of variability. Okay? And therefore, that's why they get into diseases, they get into medical conditions. So the balance is when you're out of balance. Okay? What are some of the things that we can help to keep us in good balance? Because we've talked about nutrition, very important. What other things do you think that we need to have balance? Exercise, very good. What else?
Emotional state.
Very good, excellent. We'll talk more about that. Emotional state. Sorry?
And meditation.
Meditation, quiet time for yourself.
Sleep.
Yeah, very good. I'm glad you brought that up. Sleeping. People nowadays are so tied up with computers and everything. They don't get enough sleep. And when you sleep poorly, That's when your immune system goes down.
Okay, prayer.
Prayer is part of the meditation. Okay. I find that one of the best things for people to do is spend time with nature. Nature is one of the best healing things that we have. Number one, there's so much beauty in nature, right? Look at the flowers, the colors. In my office, we have live flowers in the exam rooms and also in the whole office. I have this wonderful lady, Japanese lady in her 80s. Every Monday, she volunteers this. We buy the flowers, but she volunteers this and come to the office and make small arrangements. And that's part of the beauty. I mean, I see people get connection with nature. They say, whoa, your office atmosphere is so different. We come in here, we already feel better. And to me, that's part of the power of nature, the healing part of nature. So spend more time with nature. For myself, I find that one of the good way for me to get a balance is that I go earthing. Do some of you know what earthing is? Yeah, you go in the morning, I think it's the best time in the morning, and you go to the park or a nice grassy area and you walk barefoot, in the grass. I did that this morning and I just felt very so-called balanced.
What is it called?
Earthing.
Okay.
Touch the earth. Okay, because so often we don't do that. We wear shoes, we are, running around. But earthing to me is one of the best things that can happen. Yeah. They've actually done some good studies now with earthing, how that connects you with the earth energy. And you find it really helps to balance you out. Okay. Now we talk about stress. How can we so-called manage stress? And you mentioned about prayer, meditation, what we call quiet time. So often we don't find the time for ourselves. I love the theme of your conference, the gift of time. I think that's really wonderful. We forget about time. Many times when I tell somebody to say, you should exercise more, they say, doctor, I don't have time. So my answer to them is, what is time for? Right? Time is for to live. You need to make use of time. Yeah. It's unfortunate that sometimes people, when they have a serious illness, and then they really change. They realize that time is limited, and they really need to make use of the time. Have to have top priorities. Many people use the time nowadays to find more money, right? To get more things, to accumulate more material things. But we have to remember that we can't take any of these things with us. And material things doesn't really give us any happiness. Okay? One of the things that I really like, a term that I like, is called contentment. Now, you can be content with less. There's so many people around the world, they don't have a lot of money, they don't have a lot of material things, but they're very content. So if you have contentment in your life, then you have peace. So again, it's not material things that we need a lot of. It's what we want, satisfied with what we have, the contentment. That's really important. Now for those people that have a hard time working with stress, in my experience, one of the best things to help you with the stress is called HeartMath. Heart and M-A-T-H. You can look up their website. Excellent website. They've been scientifically studied. They have an organization in Northern California, and they've helped a lot of people to get the balance. Actually, they have some wonderful, what we call apps you can use. Yeah. They have one that's called M-Wave. You can measure your pulse. As I was mentioning, between the pulse, you have a lot of this little activity. With the measurement, you can see whether, number one, you are stressed, or whether you are so-called imbalanced. When you're in stress, the light will go red. Okay, and you know that you're under stress. Okay? Sometimes it happens so fast. You can be talking to somebody and something upsets you, the light will turn to red right away. Okay? But they teach you how to get to the balance. For example, one of the best things is breathing through your heart. You can close your eyes or visualize and just think that you're breathing with your heart, opening up your heart. And you find that the color will change. Then it goes to blue first. And then when you're really in balance, it will go to green. So it's one of the best thing I find for people that not sure where they are at and how to manage the stress. What's wonderful now, I see that because I'm on a regular, like connection with the HeartMath. Right now they have a big sale. So the books and all the gadgets and so on sale for 30%. It's well worth it. They actually have an app that you can put on your iPhone.
What was the name of the
HeartMath.
No, the name of the app.
I think the app for the iPhone is called.
It's called Inner Balance.
That's.
Inner-
I think
Inner
you're
Balance.
right. Yes, Inner Balance. Thank you. So you use that, right? Good.
Thank
And
you.
can you share with others how you find it may be helpful?
You know, I have the app, I have the devices, the biofeedback devices. I've mostly used the quick coherence technique.
Quick coherence,
And actually,
yes.
I'm doing that in the stillness thing I'm doing tomorrow with the presenter, and I'll put out
Excellent.
a written description of it, and it has the website. But
Okay.
it brings people into a state of calm very quickly,
Yes.
very easily. So it's just from stress to,
Yes.
so that's how I use it most.
Thank you. What time is your talk at tomorrow?
Actually, it's interesting, I'm doing one this afternoon on the Healthy Mind Platter, and talking about some of the same things. Tomorrow, I think it's at 9:10.
It sounds like it's definitely worthwhile to listen to what this lady has to say. No, because to me, HeartMath has been one of the best things, in terms of helping people. They call it inner coherence. Coherence means that everything is, in balance. Yeah. And after you use it, you don't have to use the app all the time. But after you use it, you actually can get to the inner coherence, the balance very quickly. Yeah. For me, because I used to meditate, I still do meditate. For me, even sometimes when you're meditating, I kind of measure myself during meditation. You find that sometimes you go off it, Whereas when you're using the M wave, it was called before, you find that to get yourself into the green zone, there's a certain amount of heart breathing and kind of like living a positive experience also. Yeah, that will help to bring the balance. Okay, I've talked about the balance part, okay. For me, language is a big part of wellness. Okay. And we don't sometimes pay enough attention to the language, the use of language. Now, often when I ask somebody, how are you? Sometimes people say, not bad. Now, you know that not bad, what does that mean? It's already working in the negative part, right? So I think we need to change our concept of language. It's really important. Because language and thoughts affects how you are. We all know about the news media, right? They want you to get excited. They want you to listen to horror stories and so on. That's why I don't even listen to the news anymore, because unfortunately they take things that are really make you excited and so on. And if you notice, the news will go on for 2-3 days, and then you hear nothing more about the situation, right? So that's why don't fill your mind with all these thoughts. It really upsets your whole balance. The other common language, just pay attention to your language. Again, somebody says, don't forget to do this. What does that mean? You already start to forget, right? It's don't forget. Why use the negative part? In fact, I'm going to write an article one day that says, don't forget to remember. Because a lot of ads in the banks and so on, they say, don't forget to check this. Don't forget to do this. I think if they reverse it and says, please remember to do this, they will get a lot more results. Remember to do this, rather than say, don't forget to do this.
I hear don't forget, and it sends me in a panic, stress.
Yes. It's amazing what we use in terms of language. Another term that I dislike, is deadline. It's used a lot, right? The deadline. To me, that's already negative. I use things like timeline or something like that. So kind of pay attention to what you're saying, actually. To your children, to each other. I have a whole lecture actually on the language of wellness. There's a whole bunch of expressions that we normally use that really we should be changing. There's a couple of good books that's on the language called Non-Violent Communication. I'm not sure whether some of you have read that book. Unfortunately, the writer of the book passed away recently. But the book has a lot of good information. about what kind of words that we are using, non-violent communication. Yeah, that's very important. Please ask any questions if you have. Yes.
Just regarding deadline, that apparently came from Andersonville, the Civil War prison, and if you stepped over that line, they'd shoot you.
It's interesting. Yeah, it's very negative. Oh, talk about language. That's the other thing that I already use in my practice. For example, I tell people when they first come in to orientate them to my practice, I say, we don't see any patients in my practice. Because when you think about it, the term patient is very passive, right? I mean, you're patient, you're not active. And the second thing about being a patient, you actually have to wait in the doctor's office patiently, maybe 1 hour, 2 hours to see the doctor. So it's really not a good term. So that's why I say we don't use the term patient. If you come to my office, you want to be seen, we say you are a health participant. Isn't that much better? I mean, because you have to participate in your health. In fact, one of the things you will hear more and more about now is they call the 4 Ps of medicine. Hopefully the young doctors will actually be starting to change their approach in medicine. You've heard of the term personalized. Jeannie Peters was saying about personalized nutrition. You have to personalize the treatment for that person because all of us are different. Our body responds differently. That's why genetic testing in the future will become pretty good. Genomics, to find out how you respond to certain medication and so on. Now that's the first P, personalized. The second P is precision. And precision medicine is very important, especially in cancer treatment, because you want to, again, use a precise molecule, the precise medication for treatment. Okay? And the third one is preventive. Preventive medicine is forerunner of so-called integrative medicine. Okay? You want to prevent an illness from occurring. It's so much easier to treat than when you have the condition of the disease. I would much rather work so-called with a person before they have the condition, and it's never too late to reverse that. That's why prevention is very important. And then the last one is called, we talk about participatory. You have to participate in your own treatments. So that's why the 4 P of medicine is very important, and you see more and more of this in the future. Okay. Any questions so far?
I don't have a question, but I have a comment.
Yes, please.
I think that we were talking about nature, being in contact with nature. And I think that gives or takes us to one other issue that is giving or giving back.
Yes.
And I live in nature and I'm a little bit shocked. I come often to the United States and
where are you from?
I'm from Bolivia in South
Bolivia.
America, and I live in the countryside, and I live with 630 animals, wild animals, and I think nature is about nature gives us a lot, but we're not really given nature back. And I think it's very important to respect nature and to realize that we belong to the wild kingdom, with the animal kingdom, to the animal kingdom. And that we need to respect nature because it's about survival as well. Because if the day that we finish with nature, we're not going to be here anymore.
Yes.
So I think that it was very cold this morning, very, very cold. And what really upset me, I mean, I was cold, but we are using too much energy, so that's not giving back to nature. Or going to the bathroom and using 5 pieces of paper to dry our hands when we can use just one. I mean, I think we need to be a little bit more aware of what is going on around, and we can give back to nature and give back to our neighbors, which I think that people in the United States are extremely caring, and that's something that amazes me. Everybody's always helping the neighbors, and I think that's very unique to your society. So you have to be proud of that, but it's also nature. So it was just.
No, thank you for sharing. That's very important. Yes, I think when we live in a city, we tend to forget about spending time with nature. Yeah. I love to travel. Of course, the thing that's bad about traveling is like is when you fly, you use up a lot of the carbon and all that. But I love to go to places, you know, where there's beautiful nature. To me, that's one of the ways that I can to nourish myself again, spending time with nature. Yeah. We all know the people that live, let's go by the ocean or in the mountains. You've heard of the term negative ions. You know, these are actually things that are very helpful and beneficial for our body system. People feel so much better when they're in that kind of environment because of the generation of the ions that are in the air. Yeah, that's why spending more time with nature, that's some of the things that I tell people, you know, when they're very depressed. I say, you know, take more time with nature. You're walking in nature, surrounding yourself with flowers, with plants. All these things really help our system.
You know, another thing I think that's important for us to be in a more positive state of life is gratitude.
I was going to mention that. Thank you. Yeah, gratitude.
Being grateful for, being grateful
Yes.
for nature and all the things that we have.
Yes.
And when you're in that positive state, it's hard to be negative.
Yes. No, the gratitude is one of the best emotions that we can use, really. And then the other part is what we call social connection, interconnectedness, you know, how important that part is. That's why it's the support system that people get from each other. Some of the other things that I have loved for myself, and I like to just kind of let you know about it, you know, if you have access to some of these things. Do some of you know what floating is? Floating. Yeah. Floating was very popular in the 70s. You've heard of the isolation tanks? You know, the people go in there. Dr. John Lilly did a lot of work with dolphins, and he found out that spending time in these kind of quietness helps you to be so much more deepening up your senses. Actually, it's coming back now, very popular. Floating is actually floating on Epsom salt. Okay, there are places nowadays that have the floating so-called clinics and rooms that you can float. The Epsom salt is not very deep, but you don't sink because it's so concentrated. Okay? Now you know the Epsom salt is mostly magnesium, right? And magnesium is so helpful for our body system. Helps our body to detoxify, and at the same time it helps to relax your muscles. So for people that have a lot of tension, for people that have difficulty sleeping and so on, I would tell them go floating. In this area, if you're from this area, into Torrance, Old Torrance, they've got a wonderful clinic. It's called the Float Clinic. Yeah, I float on a regular basis because to me that's one of the most relaxing things. You're in the dark for 90 minutes, totally no sound, quiet, and the temperature is very nice because it's your body temperature. So you just kind of float there. You might think that 90 minutes is a long time. How can I stand for 90 minutes? You know, but I'll tell you, after you float for a few times, 90 minutes seems like 30 minutes, 40 minutes. Yeah. And the wonderful thing is it really helps your whole body regenerate and also helps your mind. I have people that I know that are artists. They would be floating every week because for them it really opens up their creativity. Yeah. For me, it really deepens the senses and opens up your intuition. And you know, if you go in the float with a question, oftentimes you find the answer. It's amazing. Yes.
Are you floating on water?
You're floating on water.
Because in New Jersey and New York, just something I've just seen lately, are salt caves.
Interesting.
Have you ever heard of that?
No, I know that there are salt caves in like Utah, in Krakow, and so on. Yeah, that sounds like it's
They have them on
good.
the East Coast now.
Yeah, actually, but a lot of the floating centers actually have rooms
Okay.
that are designed. Some of them have tanks. I don't like the tanks as much because you're kind of confined in the
Yeah, I don't
space.
like that.
But the rooms are large. Like this place that I would float would be about this wide and long enough, you know, for a tall person.
Mhm.
And you can move around and so on. But you find that it's wonderful.
You lay down? Or
You lay down.
You
You lay down and you float. That's why it's called floating. Yeah. Well, the best, if you have a chance to try it, really,
I'd like to
to
try
me.
it right now.
I have a few brochures. Yes.
tub.
Mhm.
Most times, I'm in there 60 to 70 minutes. I'll put on a CD
Yeah.
and I'll just let it run.
Yes.
And I tell you, and get you a lot of water to drink while in there. But I find that to be very helpful and relaxing for me. Only problem is sometimes it's hard to get it out of the tub, but it's very relaxing for me, and it may, you know, I try to encourage my daughter to do it, but she's always too busy. But I think it's one of the best ways to just clear your mind and
Yes.
just get you some easy, relaxing music, and you can turn the jets on and then you can turn them off and just have a great time.
You know, there's so much healing element in water, as we all know. You know, hydrotherapy was very big in so-called the olden times. And when people go into the hot springs and so on and just relax there. Yeah. The water treatments are just very good. And I love water treatment. I love spas. In fact, that's one of my love for traveling. I've been to a lot of spas. Some of the best spas are in Europe, you know, where they have the natural hot springs. But locally, if you live here, Desert Hot Springs in Palm Springs area has some of the best waters. So actually, any spas they have so-called natural hot springs are wonderful. You find again many of the waters have a lot of minerals that helps you to heal. I'm not sure how our time is.
We have 20 minutes.
12 minutes, okay. I'm actually, talking about the question. You know, one of my favorite quotations from a poet, Austrian-German poet called Rilke, R-I-L-K-E. You know, we all want to have answers, right? Everybody wants answers. But I think in his wisdom, he says, live the question. Live the question. Okay? By living the question, you will get your answer. So too often, you know, the answer, you know, just trying to get an answer, we have to live the question. So kind of remember that. Sometimes when you're trying to find an answer, like I say, go floating. I know I love dreaming. I'm not sure whether some of you have kept dream journals. You know, because dreaming again is a wonderful way for your subconscious and so on to find answers. You know. If you have trouble sleeping, sometimes they find, one of the questions I ask people is that, do you recall your dreams? And if they say that they don't recall the dreams, sometimes I find that's because they're not getting enough B vitamins in their food or in the supplements. And when they start taking the B vitamins, you find that again, they might start to recall the dreams. Yeah. The other supplement that's very good, and you probably heard about, is melatonin. And melatonin is a brain hormone. Okay? And melatonin is very important for immune system. In fact, there's a doctor in Italy that treats a lot of the breast cancer patients with very high doses of melatonin because he finds that helps to boost the immune system. Okay? When I travel, because I fly across a lot of time zones, I use melatonin. Okay? And I find out that the two things that I do, I take melatonin, and when I come back, I float that day. I'll tell you, I have no problem with jet lag. I can come back from Asia, 17 hours difference. The next day I'll be at work. You know, I don't suffer like a lot of people have jet lag and so on. Okay? I think it's because number one, of course, I stay very healthy. I get good hydration. So we tend to forget again. You know, I didn't talk much about hydration, but we did talk about water. Many of the conditions that people have is due to dehydration. You know, because when you think about it, if your cells are not in a good hydration media, how is the nutrients going to be brought to your cells? That's why people a lot of times have headaches because of the hydration problem or digestive problem. Again, hydration, so important. You know. When you're sweating, obviously you're going to need to drink a lot more water. But I would say on the average, you should try to strive for at least 6 to 8 glasses or 8 ounces of water. That would, in my opinion, be so-called the minimum. Because you can count tea as part of the water because there's hardly anything. But even things like juices and milk, they are so-called liquid, but really they don't do your body as well as the regular water.
And I heard that melatonin interacts with with thyroid drugs still?
I haven't come across the melatonin and thyroid. I have to do some more research with that.
Because, I mean, I had thyroid cancer
Mhm.
a long time ago, 30 years ago, and I get my medicine every day, and
They recommended you not take melatonin.
I read that, and I would like to read more about it, but
I
long
would have
time
to
ago I
check
read
into
it.
that and see.
Mm.
Yeah. You know, if you talk about, I don't like to use the term anti-aging, you know, but rejuvenation. The melatonin is one of the best things to help with your slowing down the aging process.
I would check that.
Yeah,
Double
I would check that versus thyroid.
Double up on that.
Yeah.
Yeah. Now, and melatonin helps you to dream. You know, that's why I said I take melatonin on a fairly regular basis, not because I have sleep problem, but I love dreams. And I've kept dream journals for years. But some people that have bad dreams, probably melatonin would not be a good thing. Yeah. I think you have to try it and see. But overall, melatonin is, to me, is very positive because it's a natural brain hormone. And as people age, you know, more and more older people have difficulty sleeping at night. Part of that is due to the decrease in the melatonin. So sometimes when they start taking melatonin again, you find that they're able to go sleep better.
How many do you recommend?
I would say start with maybe about 3 milligrams. That's pretty standard. 3 milligrams. But if you find 3 milligrams makes you like the dream too vivid, you can go down to maybe try 1 milligram and see.
What else did you mention? Vitamin D or B?
B complex.
B like boy.
Yeah, B complex.
Oh, is it complex?
B complex, which means that you have a combination of B1, B2, B3, and so on, B6, the complex. Yeah. I mean, individual ones have certain properties, but it's best to take like a B complex. And you should get a B complex that's so-called hypoallergenic. Because a lot of the B complex used to be made from things like yeast and so on that people may be sensitive to. But you can nowadays find very easily hypoallergenic B complex. Yeah.
And what's the dosage for that?
B complex maybe about 25, 50 milligrams would be a good amount.
Any side effects to melatonin?
It might have to look and see what this lady say about
Other than that.
the thyroid part. The only thing, melatonin, I would say the dreams, you know, the nightmares. There may be a couple of medication I think the melatonin may interfere with. But generally it's safe because it's a normal brain hormone. Any other questions anybody would like to share?
Just a question.
Yes.
Can you comment on IV therapies such as like glutathione,
Yes.
PK, things like
Yes,
that?
yes,
What are
thank
your
you.
thoughts on that?
Yeah, we do that. A lot of the integrated medicine doctors and so on, functional doctors would do that, yes. The good thing about the IV therapies is that it does give your body a much higher dosage that you normally may not be able to absorb or digest orally in the gut, yes. But again, I think we have, you know, there's protocol for all different kind of vitamin therapy.
Like a glutathione?
Glutathione, we do quite a few like vitamin C. We find that vitamin C has been very helpful for boosting person's immune system, for healing processes, and actually for some of the, they've done some work with cancer patients, vitamin C. And of course, glutathione is very potent antioxidant. And we may add the glutathione at the end of the vitamin C IVs. Any other questions? Again, you know, I talk about body wisdom. I tell people, listen to what your body's telling you. You know, your body really can give you the best feedback. Unfortunately, you know, it was interesting that at lunchtime or after lunch we did the exercise. That the lady was asking, how many of you are afraid to tell your doctor certain things? You know, because there's a fair amount of people that came out. I felt kind of sad about that because, you know, to me, if you have difficulties with communication, part of the problems, or part of the challenge, the doctors unfortunately also play a part with that. Yeah. Number one, they don't give you much time, right? I think it's much less so, but I know that many times the doctors feel that they are superior to you. And then you have a tendency not to ask the question. But I think it's really important to really ask the questions, and then kind of work together, like I say, in collaboration. You want to participate in your health. You don't want to give that up for anything. It's really important, like I say, listen to what your body tells you. That's what I tell people. I says, we work as a team, but you have to give me the feedback, what your body's responding, how you're feeling, and so on, so that I can give you the information and work together. Because you know your body much better than me. You know what your body's telling you. So trust your body wisdom. I think that's very important. I think that's all I have, really, unless you have further questions. Well, I do have, I have actually worked on a book. You can find it on Amazon.com, because I find that educating people is very important, to let them know how to treat themselves. This book was written, I was with Deborah Mitchell, called Healing What Hurts. And this gives you a lot of natural remedies and suggestions on different kind of conditions for your body system.
One thing I think that helps a lot too is if people will write a list of what they really want to talk to the doctor about, because sometimes you get into the doctor's office, and time's an issue, but also you forget. You forget what it is you really wanted to say. So that helps both the doctor and the patient by having your list of these are all the things I want to talk to you about.
Right. I think that one thing though about the list, don't come in with too long a list. Because right away the doctor's going to be closed-minded. And remember, I think you can also say to the doctors, I would like to be an active participant in my health. I think that's a very good thing to say, that the doctor realizes that you want to make changes, that you're willing to make changes. Yes.
I think it's important, and it's nice to see hospitals that are that now have integrated medicine.
Yes,
departments.
very good point.
Memorial Sloan Kettering,
Yes.
UCLA.
Yes.
So you already have these docs there, and the oncologist is more apt to make a referral because they feel that these docs are, I don't want to say recognized, but not recognized. And I think they tend to use them more.
Yeah.
So I think what we're seeing now is a whole new world of doctors working with, specialists working with integrative medicine physicians. And I think you need to find an oncologist, a GIST specialist that is willing to look at this as something positive and be part of the overall treatment plan. And I think if you have a balance of both, you'll be healthier.
Yes, but that's an excellent point, and you're right. A lot of medical schools now and also hospitals are starting so-called integrative medicine because they realize that medicine is not the answer. You need to have people team working together for that. Actually, I feel also blessed because I started the Health Integration Center back in 1978. And remember I told you that the term integrative did come into popularity too in the 80s. So I felt that I was, quote, forerunner. I've been very blessed. Like I said, integration, we call our center the Health Integration Center. Because I realized at that time that I love working with the team. I had acupuncturists with me, I had people that do body therapy, counseling, nutrition. Because I know that I couldn't do it all by myself. It has to be teamwork. That's why I think integrative medicine not only helps so-called, quote, in cancer treatment, but really it just helps overall your health, your wellness, your well-being. Okay. All right. Remember again. What was your gift of time? Thank you again for that. I think that's wonderful.